So today we're going to be demonstrating some flexion distraction on Emily. This is one of the most commonly utilized techniques in this office for anybody that's experienced any kind of lower back pain. This patient in particular has actually had a history of some surgery, so it's a nice non-invasive way of doing a little bit of spinal decompression. It opens up all the disc spaces and allows more room for all of the nerve roots, but the best part is that it really just feels like a nice deep stretch for patients. So it's very tolerable, it's very effective, and patients really seem to like it. So flexion distraction starts with a little bit of a stretch into the lower back, and I've actually formulated my own technique for this to combine it with a little bit of muscle work in order to add a little bit of a further stretch into some of these tight muscles in the lower back. And Emily, you just let me know if there's anything that's bothering you or doesn't feel right in any way, shape, or form, okay? It should just feel like a really nice, tolerable, deep stretch right into the lower back, most people's favorite part right here. So a nice deep stretch starting on the left side here first. Does that feel okay for you? Okay, good stretch.
Yeah.
Now this should just feel like stretching on the left side. There shouldn't be any discomfort or pinching on the right side. Is that accurate?
Yeah.
Okay. So flexion distraction is actually a really non-invasive technique that we can use for people who have had a history of any surgery or who are not able to tolerate traditional chiropractic adjustments like being put on their side and twisted, because the whole purpose of a chiropractic adjustment is to add motion to joint segments. That's where that cracking sensation comes from when they're actually putting you on your side and twisting you. This does the exact same thing, but without having to do that high velocity motion, because every time that we flex you at the waist, it's opening up each individual joint segment in your lower back and throughout your vertebrae. So it feels like a good stretch, but structurally it's helping to decompress all of the structures in the lower spine, open everything up, allows more room for all of the nerve roots, and stretches the muscles at the same time. Really helpful for people with any kind of disc injury, pretty effective for people with sciatic issues. This is one of the most effective treatments for people with spinal stenosis because of the fact that it opens up that spinal canal and alleviates some of the pressure on the spinal cord.